Anyone from PhilHealth? Nawala na sila. Sorry.
PHILHEALTH.
Okay, anyway, yes, siguro we'll ask na lang PhilHealth to submit all the documents that you've been asking, no? So
yeah, one more thing na lang, Madam Chair, na gusto ko lang
yes.
ipasubmit. Gusto ko makita yung kung may nagki-claim pa on pneumonia and flu sa PhilHealth. Gusto ko lang makita yung statistics kung gaano pa karami yung nagiging considered pneumonia, nagiging considered flu, or lahat ba COVID na. I hope they could submit statistics on that one.
Okay.
So, Madam Chair, sana po mahingi na lang yung mga katanungan ko, yung mga sagot sa katanungan ko. At I hope you can set a timetable also. And I'm one with
Later
asking
on.
the suspension of
Yes,
the
yes.
circular.
Yeah.
Thank you, Madam Chair.
Thank you, thank you. I think Secretary Duque will leave at 3 p.m. But before he leave for another meeting, Secretary Duque, I have a few questions lang, Sec.
Yes, Madam Chair. Yes,
Sec,
please.
kasi you were not able to attend last hearing nung Tuesday. And I hope na discuss nila sa iyo, being the chair of the board, yung in connection with the circular on benefit payments, yung probable and the intermediate, yung retroactivity, effectivity noong circular na inilabas ng June, ginawa niyong retroactive on November. So nagkaroon po ng motion during that time, since may resolution kami, to rectify that, no, and gawin siyang prospective. And according to President Attorney Garan, he will bring that up to the members of the board, no. I hope that he mentioned kasi on tomorrow you're going to have a meeting August 25. I hope this will be one of the agenda or the soonest special meeting with the board so that you can correct that circular. Before you leave, sir, can we get your commitment?
Yes, you're right, Madam Chair. It is calendared for inclusion in the next PhilHealth board meeting. However, it cannot happen tomorrow because we have a Senate hearing. So we are moving this to August 27.
Okay.
That is what I am told. So that's well within the week. And we will address this at the board level,
Okay.
Madam Chair.
Thank you, Sec Duque.
Madam Chair,
If
Madam
I
Chair.
can request lang po, Sec Duque, that you furnish the committee on the minutes of the meeting and kung ano po yung napagdesisyonan ng inyo pong board, no? So definitely we'll hold another meeting to discuss that kung makita namin na may mga problema. Another request before I recognize Kong Kaloy. My request, being the chair of the board, Secretary Duque, kanina napag-usapan natin yung mga existing circulars or policies ninyo na parang hindi nyo na ine-exercise, no? I think in 2018, I requested this already, that you bring back or you go back to the policies, no? Review lahat ng policies from the time, 25 years na po ang PhilHealth or 27 na yata, 27 years na ang PhilHealth. So ang dami nyong i-review na policies or circulars na kung pwede sana maglabas kayo ng omnibus rules, no? Katulad nung na-bring up kanina ni DS Bernadette Herrera D. But kung magka-come up kayo again, ipapaulala lang po namin to have that consultation before coming up with another circular. Yes, Kong Kaloy.
Thank you, Madam Chair. With your the kind indulgence of the Chair, just a short interjection and some clarificatory query to Secretary Duque. I thought he was already out, kaya hindi ko ito natanong kanina. If it's possible, Madam Chair. May I proceed, Madam Chair?
Yes, yes.
Madam Chair, nabanggit kasi ni Secretary Duque kanina na yung problema natin doon sa special risk allowance, no? Mahanapan na nila ng solusyon. And he mentioned that there is this 311 million na possible source of fund, no, from the MPBF or the miscellaneous personal benefit fund and possibly from contingency fund, no, of the president. Now, my question, Madam Chair, kasi yung problema natin in the past hearings, ang kalakhan na hindi nakatanggap ng SRA nila, those health workers from the private sector, no? Marami yon. And even barangay health workers. So ang tanong ko, Madam Chair, without a legislative authority, dahil nag-expire na yung Bayanihan 1 and 2 that covers even the private healthcare workers, is it possible na dito kunin yung pondo sa MPBF and even the contingency funds, Madam Chair? So yun yung clarification na gusto kong matugunan, Madam Chair, if the good secretary can reply to that.
Okay, thank you, Madam Chair. We had a meeting last Friday, Madam Chair, with the President, and the DBM was there to give guidance. And the guidance of DBM is that we can actually provide the SRA a big number of which comes from the private hospitals, about 20,156, Madam Chair. And the computation for that is about 311 million, thereabouts. No, I don't have the exact figure, but basically it's about 311 million. And then the extension of the contracts of service of about 20,000 healthcare workers from September to December 2021 will require a funding support of about 3.6 billion. And this will come again based on the articulations of USEC Tina Kanda of BBM. Magagaling daw po doon sa contingency fund and also from the DOH, I think about 1.5 from the DOH unutilized budget according to DBM. So yung 3.6 billion yung po yung pagkabuuan para sa extension ng mga contracts na about 20,000 more or less of different healthcare workers, no? Nurses, vaccinators. I don't have the list, but we can send you the list, Your Honor, Madam Chair.
Thank you, Madam Chair. Thank you, Secretary. Ay tinanong ko po yan dahil para po siguraduhin natin na walang legal question yan later on. Baka aasa na ang ating mga private healthcare workers dahil yun nga, ang punto ko, wala na yung legal authority provided by Bayanihan 1 and Bayanihan 2. Hindi ito mga public healthcare workers that can be, yung kanilang SRA can be augmented. No? Dahil nasa publiko sila eh. The private healthcare workers is a big problem pag there is no legal authority, no? Kaya nga sabi namin baka kailangan pabilisin natin yung Bayanihan 3 at ipasok ito as an amendment doon sa Bayanihan 3. Because there may arise a legal question on this, Madam Chair, no? MPBF ito, pondo public funds ito that cannot be given to at least this is my opinion. So, yun lang ang malaking question diyan, Madam Chair, no?
Okay.
I hope pag-aralan itong mabuti ng DOH dahil baka aasa na naman sa wala ang ating mga private healthcare workers na napag-iwanan na nga dito sa pagbibigay ng SRA. Thank you, Madam.
Thank you, Kaloy. Before umalis po si Sec Duque, again, no, i-reiterate ko lang, yung motion kanina ni Congging to review and possibly, how do you call that? Possibly suspend the circular. May we hear the commitment from the chairman of the board, Secretary Duque, before po kayo umalis?
It's a management call, actually. We will, however, look at any policy gaps, no, that there might be in the implementation of this circular. But we are sensitive to the plea that we should reconsider this circular and will be taken up at the board level. We just need to establish a legal basis for the actions of the board. Thank you.
Sec Duque, I think na-recognize nyo naman po ang urgency of this matter. Ano, I hope on
Yes.
the 27th meeting, board meeting, this will be included in the agenda.
Yes, Madam Chair, you have my reassurance. You have my word. Thank you.
Okay, because we're going to call you again on Monday, no, to update us, no, kung ano po yung nangyari. Kasi I think united ang members of this committee and also the non-members doon sa call na isuspend itong atin pong kalalabas na circular. Again, yung issue po ng unpaid claims to the hospitals for COVID and non-COVID cases, payments of COVID tests. I think there was an order already from the Malacanang to pay it immediately. And still, the Hospital Association has been saying na malaki pa rin ang unpaid claims. So, papaano nyo po nire-reconcile?
Again, Madam Chair, this is purely a management prerogative and decision to address all of these claims of delayed reimbursements. So we have been taking note of all these issues raised, and we can elevate this to the board and see how we can further improve the current system of accelerated payment through the debit credit payment mechanism.
Yeah,
So we'll see.
Yeah.
So,
Okay, yung debit credit payment kasi ninyo, meron kayong qualifiers, di ba? Hindi naman siya katulad before nung sa IRM na all facilities. So, identified lang in certain localities yung pwedeng mag-participate or mag-benefit on debit credit. So I think still, ang ating pinakatugon dito is bilisan yung assessment ng ating mga claims at mabayaran ng mabilisan yung mga good claims natin.
I understand, Madam Chair, that the good claims turnaround time is significantly much shorter, so that this should be paid without delay. And for other claims, we have to exercise due diligence and prudence to make sure that those claims are clean. And if there are questions, then it is the right of management to ask for documents that will complete the requirement for prompt payment.
Okay. Thank you, Secretary Duque. We'll look forward doon sa action po ng Board of Directors through you, and of course, yung management then through kay Attorney Geran. Next to ask question is Representative Arlene Brosas. I think Representative Marilu Arroyo yield her slot to Representative Arlene. Or time. Kong Arlene, are you still with us?
Yes, thank you, Madam Chair. Maraming
Please
salamat,
proceed.
Madam Chair. Madam Chair, mukhang yung ibang mga questions naman ay nasagot na. So, yung ilan na lang siguro na kailangan nating bigyan ng diin. For example, yung gusto ko sanang itanong kanina kung nalulugi ba ang PhilHealth, nasagot na po yan dahil meron ngang reserve fund na 640 billion ang PhilHealth. Sa ngayon kanina sa discussion, at kumita pa nga ng 30.1 billion. May net cash flow na 55 billion with collections and other income exceeding payment of benefit claims and other expenses, based sa kanyang annual report. So, Madam Chair, hindi itong dahilan kung bakit nagkakaroon ng temporary suspension of claims. Pero, Madam Chair, etong tama po ba? Siguro pasagutin natin yung hindi dahil walang pera or walang cash ngayon ang PhilHealth, kung kaya hindi sila kung kaya may memo circular na ito ngayon.
Anyone from PhilHealth? Are you still with us?
it is not running dry on cash considering the continuing subsidies and collections.
PhilHealth?
Confirm lang po.
Madam Chair, we will give you Attorney Rocky.
Attorney Roque?
Yes, good afternoon, Madam Chair. Yes, opo, I'm confirming that based on my statement earlier about the assets or the income of PhilHealth and reserve funds, this is not the reason why PhilHealth issued the TSPC. Madam Chair, as discussed earlier, the main reason of this issuance of TSPC is as a temporary measure on the part of PhilHealth in order to ensure that payment will be made only to all those valid claims. But again, of course, there are several discussions on this that the management is taking cognizance of, but we have to review and to check this, Madam Chair. Thank you.
Thank you.
Go
May I
ahead.
proceed, Madam Chair? Yes,
Thank you,
Madam
ma'am. Opo.
Madam Chair, my hope, baka sakaling yung ospital ng Quezon mabayaran. Madam Chair, yung second question ko po, kasi maraming ospital ang hindi mababayaran kapag nagpatuloy itong memo circular. Madam Chair, kaugnay po doon sa, para kasing ang nangyayari, ang question ng mga hospitals, this will just, yung circular na ito, will just further justify the non-payment of thousands of PhilHealth claims. Kasi hindi lang naman po ito ngayon. Tama po ba ang tanong natin sa PhilHealth? Kasi marami pong naiwan even noong 2020, 2019, 2018, as far back as 2017. Tama po ba? Na may mga claims pa ng mga panahon na yan na hindi na process.
PhilHealth?
Madam Chair, if I may, Attorney Santos.
Attorney Ellie?
Yes, Madam Chair, based on the statements and claim of the hospitals, that's correct, Madam Chair.
Yes, Madam Chair, kanina nga sinabi natin, yung PhilHealth, siya yung tagagawa ng patakaran, siya yung tagabayad, sila rin ang magko-compute, sila rin yung magbabayad kapag nag-compute, no? So, pag nagka-problema, sila rin ang magsasabi kung saan nagka-problema. So, Madam Chair, halimbawa, yung mga documentation, erroneous data, late filing, na mga marami pang reasons, Madam Chair, bakit ito tumagal ng ganito? 2020, well, di ba? Parang kung sinasabi na pinoprocess ito, bakit hindi ba ito ay weakness talaga ng PhilHealth?
Madam Chair, if I may, Santos,
Yes,
Madam Chair.
Attorney Ellie.
Madam Chair, based on my experience, there were many statements like that, similar statements given by healthcare providers. But upon reconciliation, Madam Chair, and upon continuous consultation with them, we were able to resolve the issues, meaning we found out that those claims that they're saying that we have not yet paid were already paid. Some were even not yet submitted or refiled to PhilHealth. It's just that the hospitals have different accounting practices with that of PhilHealth. So they treat their receivables differently from PhilHealth, Madam Chair. But our strategy, Madam Chair, as directed by PCO Dantegiran, is to always and continuously reconcile with the hospitals, Madam Chair, to prevent these discrepancies in the figures, Madam Chair. Honorable Representative Brosas.
Okay, so hindi naman dahil ayaw niyong magbayad, hindi naman ito justification ng hindi magbayad sa mga ospital, kasi alam natin yung effect nito sa ospital Yung sweldo hindi magiging on time. Yung tubig at saka yung kuryente hindi agad mababayaran. Yung repairs at saka yung purchase ng mga equipments, ma-on hold yan. at therefore yung service magde-deteriorate. Ganun po yung effect kapag hindi nababayaran, lalong-lalo na yung mga unclaimed, no? Yung mga PhilHealth claims na ito. Madam Chair, ganun ang effect sa ospital. In short, parang inano mo nga, mag-wither away ang mga ospital kapag ganito ang maging trajectory ng PhilHealth memo circular na ito.
This respond, PhilHealth.
Madam Chair, if I may, Attorney Santos. Madam Chair, we perfectly understand the situation, Madam Chair. And that's why we commit, Madam Chair, based on the statement of our beloved President and CEO, Dante Garan, that we will revisit this policy, Madam Chair. And we have continuously met with our partners, healthcare providers, Madam Chair, to resolve this issue, Madam Chair. Nothing is final, Madam Chair. We open, PhilHealth is open to changes and adjustment, Madam Chair. Thank you, Madam Chair.
Thank you, Madam Chair. Madam Chair, for the very, actually, ito lang sa panahon lang ng Duterte administration, parang ang tindi-tindi o ang higpit, no, ng PhilHealth, lalong-lalo na sa mga ospital at sa panahon pa ng pandemya. Ito po yung inaalala namin talaga ngayon eh. Wala pong problema if you're after dun sa fraudulent acts, unethical acts, abuse of authority, but if it will affect po most of our doctors, healthcare workers, at lalong-lalo na yung ordinaryong Pilipino, no, na nasa ospital, na nasa mga overwhelmed hospitals natin ngayon, dun po kami umaangal, Madam Chair. We cannot invoke the necessity of straightening supposed fraudulent claims at the expense of our doctors na healthcare workers at saka mga ordinaryong Pilipino habang nasa pandemya tayo. We fear that this PhilHealth Circular number 2021-0013 would inflict further injury to the finances of overwhelmed hospitals, especially po yung mga public hospitals who are running low on government funding. Tapos at the same time, sinasabi po natin na this underscores the problem of an insurance-based healthcare system. Cash flows are put on priority instead of ensuring immediate healthcare to our kababayans in this difficult time. Kahit po sa panahon ngayon, sinasabi natin, Madam Chair, na kailangan nating magbalanse. At ngayon po yung panahon na yung mga mahihirap at saka yung mga pasyente at saka yung mga ospital na maliliit saka yung mga healthcare workers natin, doon po ang pag-prioritize sa panahon ngayon, Madam Chair. So we support, Madam Chair, actually, the call to suspension of the memo circular, Madam Chair.
Thank you, Kong Arlene. Thank you. Are you done, Kong Arlene? May additional
Yes,
lang.
Madam Chair.
Yes, thank you.
Pahingi na lang po tayo ulit ng report from sa mga, kasi di ba binanggit naman nila yung 2020, 2019, 2018, 2017, as far back as that, no,
Yes.
na mga unpaid claims.
Yes, yes.
Mga naiwan
So,
nila.
Yes,
Madam
thank you. Thank you, Kong Arlene. Hiningi na natin yung data sa kanila and we're expecting the soonest possible. They will submit it to the Committee on Health. If I may ask lang, from PhilHealth, from 2016 na na-issue ang temporary suspension, how many of the claims are suspended?
Madam Chair, if I may I request, Madam Chair, Dr. Lambert David to answer that question, Madam Chair, if he has the data, Madam Chair.
Yes.
Yes, Madam Chair. Regarding your question, up to now, o yung total number na affected claims, yung suspension
Yeah,
nila?
yung kasi 'di ba 2016 pa po kayo, may basehan niyo po yung temporary suspension
Yes
up to before you release this new circular. So, how many claims are suspended now as per processing because of that TSPC?
As of report from our accreditation department, wala pong naka-TSPC now. lahat pong na TSPC in the past from 2019 nag-resume processing na po. Lahat po na na-hold na claim, binayaran na po.
Pero you mentioned that you have 30 healthcare providers na suspended, right?
Madam Chair, based na sa report na galing po sa ACRE department namin, 20 na TSPC pero na-serve na po yung TSPC, meaning tapos na po yung TSPC nila at nag-resume na yung payment sa kanila po.
Okay,
Tapos,
so currently, Dr. David, kasi ito nakita kong data, Hospital 8, freestanding dialysis 10, maternity lying in 2, Doctor 6. Lahat ng ito, total of how many? 12, 18, 26, lifted na ang TSPC. Meron na lang kayong 4 na ongoing. Am I right?
Yes, Madam Chair.
Sorry.
Madam,
So 26 lifted, may 4 na ongoing. So clear tayo doon. Dr. Almora, can you confirm that data? Or Dr. Degrano? Dr. Almora or Dr. Degrano?
Jim.
Yes, Dr. Degrano. Sir?
Opo. Yes, Madam Chair.
Doc, sabi po ng PhilHealth, currently wala na silang may TSPC na facilities, both in government and private, except for the 4 na ongoing.
Baka po, kasi po merong, actually, meron kaming isang kaka-viber lang po sa amin last night. Ng isa pong hospital na maliit na hospital na nasa Mindanao. No? Ireklamo po sila kasi hanggang ngayon po, naka-hold pa yung kanilang accreditation. Kaya hindi po, I don't know po, yung sinasabi po nila na wala right now. So, yun po, ito po isang hospital na ito po ay nahingi nga po ng tulong sa amin dahil para more than 5 months na daw po na sila ay naka-hold.
So, babalikan ko po yung PhilHealth. Kung na-lift na yan, ang findings ninyo doon sa suspicion ay na-clear. Tama ba? Kung lifted? Cleared yung mga claims na allegedly kaya kayo nag-file ay merong fraudulent acts.
Yes.
Tama ba, Attorney Degrano or Attorney Tolentino or Dr. David?
May I be allowed to speak, Madam
Yes,
Chair?
Dr. Degrano.
Hindi. Sino po?
Sorry. Attorney Balbo. I'm so sorry, na-confused na ako. Attorney
Barbado, Madam Chair.
Barbado. Okay, sige.
Actually, Madam Chair, yung mga na-subject namin sa TSPC, meron pa po mga ongoing cases, iba po rin na desisyonan na.
Attorney, wala tayong meeting of the minds, ha? Kasi nung tinanong ko kanina, sabi niyo wala na, lifted na yung 26 na minention ko. Which means, wala na tayong tinitingnan na mga claims. Ibig sabihin na clear sila at sinabi niyo, kung may 4, ang kasunod ko kasing tanong, kung may 4 na ongoing, so dapat meron kayong claims na suspended at this time. Kasi yun yung nasa policy.
Madam Chair?
Yes,
If I may,
okay,
Dr.
sige.
Herrera po.
Yes, Dr. Herrera.
Yes, Madam Chair, I was informed that there are still 4 healthcare providers that will be served the notice of TSPC. So until ma-receive po nila yung TSPC, it will not take effect po. It will take effect on the day after the receipt of the notice.
Okay.
Madam Chair,
So, 4 yan na facilities, no, na may ongoing. And isi-serve pa yung kanilang suspension.
Suspension of payment of claims, Madam Chair. It is different from suspension of accreditation po. Thank you, Madam Chair.
Okay, sige. Malinaw po yun ha. Ang ganda lang kasi nung sinabi na 26 facilities na nagkaroon ng allegations of fraud and then na-lift at nakita natin na hindi sila guilty of that. So, maganda yun, no? So, kasi may mga nababasa po ako sa mga comments ng mga hearings and mga interviews. Ang binabash ay ang hospitals and doctors, which is, I think, very painful for them, no? Na sila ang nagsasacrifice and nagpo-provide. So parang ginajudge na natin, base kasi ito sa mga statements din ng PhilHealth. I think yun yung nagiging problema natin, nagki-create ng maraming suspicion at pinagbibintangan na ang lahat ng mga doktor. Nadadamay din po yung ating mga nagsasakripisyo na hindi naman gumagawa talaga. So yun yung gusto kong balikan. Okay, babalikan ko lang po. Yung 2018 I conducted a hearing and dialogue between PhilHealth, PHA, and PHAPI with the President then, President Ferrer. At ang diniscuss natin, same issue on quasi-judicial power, the systems that you have right now, on the filing of e-claims. I asked for the suspension of CF4 implementation, if I remember that correctly. And then nabalitaan ko ngayon, with the CF4, hinihingi na naman ninyo lahat ng mga attached documents. From CF1, CF2, sabi nyo, simplify natin. And then ngayon, with the COVID, ang daming attached, parang documents that you need to attach that will delay the filing of e-claims, no? So ngayon, saan ang direction, saan po papunta ang direction ng PhilHealth when it comes to filing of claims, kasi mukhang hindi natin pa rin at this time na perfect yung CF4 on e-claims. Anyone from PhilHealth?
Madam Chair, if I may, Attorney Santos, Madam Chair.
Yes, Attorney Ellie.
Madam Chair, may I borrow the words of our Chairperson, Secretary Duque, Madam Chair? He said that the easiest thing for PhilHealth to do is to pay easily all these claims, Madam Chair. Pay it. That's the easiest thing to do. That's what he said, Madam Chair. However, Madam Chair, there are auditing, accounting rules that PhilHealth must also observe. If not, we will be charged, Madam Chair. Madam Chair, my personal view on this is that we will assist hospitals through consultation, reconciliation, and all strategies so that they will submit more or less perfect claims so that there's nothing more to do by PhilHealth except to pay those claims, Madam Chair. And we have already implemented strategies, Madam Chair, to improve our policies, to improve our IT system, and to augment our personnel, Madam Chair. So PhilHealth, Madam Chair, is doing its best to address this present problem, Madam Chair. Thank you, Madam Chair.
Thank you, Attorney Ellie. This is recorded. You have that commitment, no? Improve the system, the policies, and yung payment problems natin. Okay, I think nandun na lahat yon. Kasi ang kasunod ko dapat na tanong, gaano kabilis naman nadidesisyonan yung denied cases? Kasi subject to appeal siya. Kasi from previous reports, no, in previous years, it will take mga years before kayo makadecide kung yung appeal ba ay nag-grant or hindi. So, gaano kabilis at this time, yung turnaround time natin ng appeal? Kasi dumadaan ito, I think, Attorney Ellie, tama ba, sa legal?
Yes, Madam Chair, it passes through the Protest and Appeals Review Department, Madam Chair. Madam Chair, to tell you the truth, the employees in the PARD are going on duty 24 hours a day, Madam Chair, on an 8-hour shift, Madam Chair. But as to the data, Madam Chair, as to the specifics, may I request, Madam Chair, that Attorney J.M. Tolentino be recognized to provide this data, Madam Chair.
Attorney J.M., Attorney Tolentino.
Yes, Madam Chair. Although all those all those denied claims, Madam Chair,
Yes.
from the pros, doon po kasi nagsisimula yan eh. Doon nagki-claim yung mga ano natin doon sa mga regional offices
So
natin.
from regional offices, sila ang nagde-denied ng cases, right? Ng claims.
If they have reasons or grounds for the
Deny.
denial.
And then,
Opo,
saan po
dinedeny.
nag-a-appeal? Sa region din?
May isa pa hong, I forgot the name of the committee on the region. May appeal pa ho doon. Tapos MR. Tapos pag hindi pa rin ho talaga, ano po, aggrieved parties may elevate
To central
via an appeal sa central office, sa protest appeals and review department.
Yan. So nakita po natin dyan, actually it's a very, very long process. Ang dami ko na pong narinig na yung mga denied cases nila ay tumagal na hanggang sa hindi na nabayadan. That's why I saw doon sa data ninyo, I don't know how much na-reconcile nyo po ba yung data the PHA has and your data? Doon sa ongoing process, RTH, and the denied claims. So magkaiba po kayo ng data from the data presented by Dr. Shirley Domingo and Dr. Almora. Na-reconcile niyo po ba yung mga data niyo?
Ma'am, may I answer that?
Yes.
Yes. Thank you, ma'am. We have provided Dr. Almora and Dr. De Grano with the corrected data. So, just to tell you, ma'am, in the 86 billion, we corrected that because the in-process claims as of June 30, which was also the period that they used, is 12.9 billion instead of the 26.5 billion. And the RTH is 9 billion, while the claims amount is denied claims is 6 billion. So that's
how much is RTH? Magkano po ang RTH?
9 billion, ma'am.
That is as of what? Anong date po yan?
This is 2020, ma'am, until June 30, 2021.
Okay. Now, Doktora Shirley, yung RTH natin na 9 billion is malaking amount yan, no? And alam natin ang laki ng effect nito sa operation ng hospital. How can you improve the process on RTH? Kasi ang simple ng reasons for RTH. But nung tiningnan ko, it's more of the system problem. Ang RTH nyo.
Yes, ma'am. We realize that. So our regions and our operations, maybe Attorney Eli wants to say that, but initially our regions and our operations have delved into the root causes of RTH. Because, ma'am, once we return a claim and refile to us, it's like going to our systems twice, and therefore it's also disadvantageous to us. Therefore, they identified the reasons for that, and what they're doing is try to retrain our hospitals at the regional level on submitting correct claims and doing information campaigns.
Yeah, Dr. Shirley, system talaga siya eh. System ang problema. I've seen it. Nagpa-walkthrough ako kung paano at anong nagiging problema. Pero kasi yung RTH, evaluate nyo, i-return nyo sa hospital, dadaan siya ng LIO, from LIO, saka pa siya pupunta sa hospital, no? So ilang days yun, and the hospital has to comply it again, forward it to you, but ang daming factors to consider. For example, nung in-implement nyo yung e-claims, did you look on the connectivity? Ang connectivity, majority naman, even nga in Metro Manila, may downtime din no? Meron ding mga dead spots. So nung nag-e-claims tayo, affected yung mga places na very poor ang connectivity. So that might be the reason also for mga RTH natin and late on filings of e-claims, no? Nagkakaproblema. But may nakita din na marami doon sa system between you and the third-party provider. If meron third-party provider and the system itself for those big hospitals na meron silang kinreate na in-house system, yung HIS nila. So, again, we'll go back to the question raised kanina ng isa nating colleague, yung I think si DS Bernadette Herrera. That's why natanong ko to kay Doc Art before. ano yung naka-pipeline. Kasi naalala ko, before last year, I think before COVID ba yun, na there was an investigation on system, I think IT infrastructure improvement, which yun yung inaabangan natin that will help sana, one of the safeguards doon sa fraud natin is to have that strong system. So yun yung question ko ngayon, naituloy ba yung plano doon sa improvement of IT infrastructure, or did you get a third-party provider to help you improve that system?
Yes, maybe Doc Art, our SVP for IT, they have several reforms on the line in our IT system. Maybe he can expound on it.
If I may, Madam Chair, no. Actually, we're in talks now with with some providers po. Like for example po yung mga nag-provide po with the other agencies na pwede nila pong i-beef up po yung mga aming infrastructure through PPP kasi at no cost to the agency. Pero we have to present this po to the management for approval po, no. And actually po, marami po kaming naka-pipeline. Kaya lang po may mga dependencies din po kami with the other agencies for approval. So kaya po medyo nadidelay po yung aming projects, no. Kaya yung priorities po ni President Giran is yung digital transformation. Pina-prioritize po namin siya, kaya po yung mga major na projects po namin ay binibigyan po namin importansya para po ma-improve po yung mga process po of submission ng claims and pag-process ng claims, including po mabigyang solusyon po yung RTH at yung mga-deny.
Okay, sige. Siguro po we'll ask you again, we'll call you again here in Congress to present us on the progress that you made, no? Over the coming weeks and months. Ano pong nangyari doon sa pondo dati ng IT? Supposed to be. What happened?
As I've heard po, no, kasi kaka-assume ko lang po noong November, no, wala pong naging procurement po noong 2020, no, because of the investigations that was held last year, no. So parang hindi po napirmahan yung mga procurements po. Kaya po ngayon po namin nag-proceed yung mga ibang projects po namin na nabinbin po noong 2020. So kaya po siguro medyo nagkaroon po ng problema with some of the systems because of what happened po last year na hindi po nabili yung mga infra na yon, yung mga resources na yon. So kaya ngayon po na-experience po yung effects po ng na yon, ng hindi pagbili ng mga resources na yun. Yun
Okay,
lang po.
but this year, meron kayong budget for procurement?
Meron pong nakalaan po na na-approve po ng DICT at saka po ng aming board at saka management po.
Okay, thank you, Doc Art. I think, do we still have members who wishes to ask question? Do we still have members? Naiwan na yata ako kasi nagpe-plenary na sila. Anyway, I think that's all for today. Thank you so much to PhilHealth family for your time, headed by Attorney Dante Geran. Of course, to the family of DOH headed by Secretary Duque. Maraming salamat. From PHA, Dr. Almora, Dr. De Grano from PHAPI, PMA Dr. Atienza, and the rest of the members of the organization. Maraming salamat sa ating mga members who attended on today's hearing. So narinig naman natin kanina yung atin pong motion, no? And I think Attorney Geran is still with us. Do we still have Attorney Geran?
Yes, ma'am, of course.
Yeah, sir,
Chairman.
expecting that you're going to make kalampag the board of directors po, ha? Sir, na sana ma-actionan po ang kailangan niyo pong ibalik sa amin yung action from last week's hearing, no, on the benefit payments of the probable and the rectification ng ating circular issued in June 2017 to June 2021. And this one, no, ang majority of the members, or almost 100% of the members present today at this hearing, agreed that this circular needs to be reviewed and if possible to suspend, no? So hihintayin po namin, holiday po on Monday, so the Committee on Health is expecting a report on Tuesday from you, sir. Pwede po ba yon?
Will do, ma'am, as directed po.
Okay, thank you so much. Maraming salamat po. Any members?
I move to adjourn, Madam Chair. Ito pa ako.
Kala ko naiwan na ako mag-isa, wala mag-second. There's a motion to adjourn this meeting. Very productive po ang ating meeting sa ating pong mga hospital partners, no, healthcare providers. Doc Almora, maraming salamat po sa inyo. Rest assured that the committee will work hard para po sa ikagagaling for the benefit of both parties, no? PhilHealth and DOH for our countrymen. Maraming salamat po sa inyong lahat. Sec Duque, maraming salamat po. This meeting is now adjourned.
Thank you, Madam Chair. Thank you sa lahat.
Thank you, Madam Chair.
Thank you din po, Kong Helen. Thank you.